You ready for this? You ready to see my patient? Mr. Horseman. Alright, so let's get this patient assessment on its way. First thing I'm going to do is review my patient's history prior to even meeting him, looking at his chart. As I walk up to him in the waiting room, I will introduce myself. Hello, sir. My name is Jenny. I will be your nurse today. The procedure I'm going to explain to you is the patient assessment. We will be assessing you to see how your general health is today. I am going to bring him back to a room to ensure patient privacy, and I'm going to have him identify himself using two identifiers, generally his name and date of birth. As we are going back to the assessment, I will perform hand hygiene. I'm going to be assessing his gait, his posture, his balance. We are also going to stop at the scale, get a height, get a weight on him so I can calculate BMI. We will also be doing the Snellen chart to check his visual acuity. Congratulations, you have 20/20 vision, because I don't have one of those to mimic. So, get back in the patient room. I will have him undressed, get into a patient gown. That way I can check over his entire skin, look for any lesions, deformities, bruising, anything out of the ordinary. And to be organized, we will start with his assessment, starting at his head. We will check the hair, check for growth patterns, baldness, color deviations, infestation, oiliness, texture. We will check his ears with an otoscope, looking for wax or infestation, looking for the pearly glossiness of his tympanic membrane. We will check the symmetry of his face. We will check the size of his skull. We're going to look at his eyes for any drainage. We will look at his pupils, see if they are pearl. We're going to check his accommodation. Sir, can you keep your head perfectly still, facing forward, and follow the light with your eyes only? Next, we will check his nose, see if there's any congestion or drainage or deviations, such as his septum having a giant hole in it. We will check the patency, plugging one nostril, having him sniff, and then we'll plug the other nostril and have him sniff. We will look in his mouth, check his teeth or his dentures. This guy's palate is soft and it likes to fall down. We're going to don the appropriate BSI and perform hand hygiene, and I will take a culture of the back of his throat. As we're doing that, he will say, ah, and I can look at the uvula rising. Next, I'm going to check his lymph nodes. Check in front of the ear, check behind the ear, check the chin, under the mandible, tonsillar, down the neck, and in the pocket of the clavicle. While he's doing that, he'll turn his head so that we can get the nice pockets to feel. I can also assess his range of motion as he is turning his head. I'm going to check out his neck, feel the back for his spinous processes, check the muscles, have him shrug his shoulders, check his trachea, see if it's midline, and note if there's any JVD. I am going to auscultate his lung sounds. Leaning forward, I'm going to listen in the back. I'm going to compare lobes side to side. I can check my axillary. Check lung sounds in the front. As he's taking deep breaths, he's in a patient gown. I am not listening to lung sounds through the clothing. I can flip it over, listen to heart sounds, listening. Ape to man, atrial, pulmonic, herb, tricuspid, and mitral. I'm going to find the point of maximum. I can feel for that, feel for any extra thrills or pulses. I'm going to listen for any extra sounds, any gallops, any murmurs, any rubbing. I will acquire a buddy to feel for pulse deficits, where my coworker would palpate the point of maximum impact, and I would feel for a radial, and we would compare numbers. Then I can check his extremities. So, sir, can you touch your fingers to your nose? Can you touch your finger to mine and then touch your nose? And we're going to compare radial pulses. I'm going to look at the skin, checking for turgor, cyanosis, abrasions, or lesions. I'm going to look at his fingernail, see if there's any cyanosis, any clubbing, and look at the tissues around it, see if there's any nail biting or anything not good. Don't get fresh with me. I will then go to the lower extremities. I would check the patellar tendon by having his leg relaxed, and then I would just kind of right underneath the kneecap give it a good dunk, and it would kick his leg out. I will check for edema, but also make sure to look at the skin as well in the extremities. On the feet, I would put some pressure on his feet and tell him to pull his toes towards his nose, then push down like you are stepping on the gas pedal. I could feel for posterior tibial or dorsal pedis pulses, comparing both sides. And then I'm going to have my patient lay down. And I am going to auscultate the abdomen, starting in the lower right, listening for bowel sounds, listening for up to 5 minutes, and working in a clockwise direction. Then I would listen midline, just below the navel. Listen for vascular sounds, like the aorta, see if there's any bruits or anything of the sorts. Then I would percuss the abdomen, listening for solid or hollow sounds. Then I would palpate the abdomen, working in the same clockwise direction. I would assist my patient back into a comfortable position. Gotta work on your posture, man. Document all of my findings, and I would explain my findings as well to the patient, and perform hand hygiene again.